Welcome back to MCQs Master 101. In today's Nclex Mastery session, we're tackling 50 mixed high-stakes patient triage case studies designed to challenge your clinical judgment exactly the way the Nclex does. These are not simple recall questions. You'll face emergency department scenarios, critical care emergencies, rapid response situations, shock states, stroke alerts, STEMIs, pulmonary embolisms, and multiple unstable patients competing for your attention at the same time. As you answer each question, focus on the Nclex priority frameworks: airway, breathing, circulation, acute versus chronic conditions, unstable versus stable clients, and expected versus unexpected findings. Pause the video, choose your answer, and see if you can identify the client that requires immediate assessment before viewing the rationale. Let's begin and test your triage skills. Question 1. A nurse working in a busy emergency department receives report on 4 newly arrived clients. The first client is a 68-year-old with a history of chronic obstructive pulmonary disease who is experiencing increasing shortness of breath and has an oxygen saturation of 86% on room air. The second client is a 42-year-old with a closed tibial fracture who reports severe pain, rated 9 out of 10 despite receiving pain medication 30 minutes ago. The third client is a 24-year-old with a fever of 101.8 degrees Fahrenheit, 38.8 degrees Celsius, sore throat, and generalized fatigue for 3 days. The fourth client is a 56-year-old who suddenly developed slurred speech and right-sided weakness 45 minutes ago. Which client should the nurse assess first? A. The 68-year-old client with COPD and oxygen saturation of 86%. B. The 42-year-old client with a closed tibial fracture and severe pain. C. The 24-year-old client with fever, sore throat, and fatigue. D. The 56-year-old client with sudden slurred speech and right-sided weakness. Answer: D. The 56-year-old client with sudden slurred speech and right-sided weakness. Rationale: sudden neurological deficits indicate an acute stroke. Because symptom onset occurred only 45 minutes ago, rapid assessment is essential to determine eligibility for thrombolytic therapy and prevent permanent neurological injury. Question 2. A medical surgical nurse is beginning a shift and receives report on 4 assigned clients. One client was admitted with diabetic ketoacidosis and has a blood glucose of 320 milligrams per deciliter after treatment. Another client underwent a laparoscopic cholecystectomy 8 hours ago and reports shoulder discomfort. A third client has heart failure and suddenly develops pink, frothy sputum with severe dyspnea. The fourth client has a urinary tract infection and is awaiting discharge instructions. Which client requires immediate assessment? A. The client with diabetic ketoacidosis and blood glucose of 320 milligrams per deciliter. B. The client 8 hours post-laparoscopic cholecystectomy with shoulder discomfort. C. The client with heart failure who develops pink, frothy sputum, and severe dyspnea. D. The client with a urinary tract infection awaiting discharge instructions. Answer: C. The client with heart failure who develops pink, frothy sputum, and severe dyspnea. Rationale: pink frothy sputum is a classic sign of acute pulmonary edema. The client is experiencing a life-threatening breathing problem that requires immediate intervention. Question 3. A nurse in a telemetry unit is caring for 4 clients. One client has atrial fibrillation with a heart rate of 98 per minute. Another client reports chest pain rated 8 out of 10 accompanied by diaphoresis and nausea. A third client is requesting assistance to ambulate to the bathroom. The fourth client has a potassium level of 3.4 milliequivalent/L and is awaiting scheduled supplementation. Which client should the nurse see first? A. The client with atrial fibrillation and a heart rate of 98 per minute. B. The client reporting chest pain with diaphoresis and nausea. C. The client requesting assistance to ambulate. D. The client with potassium level of 3.4 milliequivalent/L. Answer: B. The client reporting chest pain with diaphoresis and nausea. Rationale: these symptoms are highly suggestive of acute coronary syndrome or myocardial infarction. Rapid assessment and treatment are necessary to limit myocardial damage. Question 4. A nurse working on a neurological unit is assigned 4 clients. One client had a seizure 2 hours ago and is now sleeping. Another client with bacterial meningitis reports a severe headache, but has stable vital signs. A third client who underwent a craniotomy yesterday becomes increasingly restless and difficult to arouse. A fourth client with multiple sclerosis requests pain medication. Which client should the nurse assess first? A. The client who had a seizure 2 hours ago and is sleeping. B. The client with bacterial meningitis and severe headache. C. The client who underwent a craniotomy and is increasingly restless and difficult to arouse. D. The client with multiple sclerosis requesting pain medication. Answer. C. The client who underwent a craniotomy and is increasingly restless and difficult to arouse. Rationale: restlessness and decreased level of consciousness following brain surgery may indicate increased intracranial pressure or intracranial hemorrhage and require immediate evaluation. Question 5. A nurse in a postpartum unit receives report on 4 clients. One client delivered 2 hours ago and saturates 1 perineal pad every 15 minutes. Another client reports perineal discomfort rated 4 out of 10. A third client is breastfeeding successfully for the first time. A fourth client asks questions regarding newborn bathing techniques. Which client should be assessed first? A. The client saturating 1 perineal pad every 15 minutes. B. The client reporting perineal discomfort rated 4 out of 10. C. The client breastfeeding successfully. D. The client requesting newborn bathing information. Answer. A. The client saturating 1 perineal pad every 15 minutes. Rationale: excessive postpartum bleeding is a sign of postpartum hemorrhage, a potentially fatal complication that can rapidly lead to hypovolemic shock. Question 6. A nurse in the intensive care unit is monitoring 4 clients. One client has septic shock and a mean arterial pressure of 58 millimeters of mercury despite fluid resuscitation. Another client has a temperature of 101.2 degrees Fahrenheit, 38.4 degrees Celsius. A third client requests repositioning. The fourth client reports difficulty sleeping. Which client should receive priority assessment? A. The client with septic shock and a MAP of 58 millimeters of mercury. B. The client with a temperature of 101.2 degrees Fahrenheit, 38.4 degrees Celsius. C. The client requesting repositioning. D. The client reporting difficulty sleeping. Answer. A. The client with septic shock and a MAP of 58 millimeters of mercury. Rationale: a MAP below 65 millimeters of mercury indicates inadequate organ perfusion and places the client at risk for multiple organ dysfunction and death. Question 7. A nurse in the emergency department is caring for 4 clients after a motor vehicle collision. One client has a deformed wrist with intact pulses. Another client has abdominal bruising and increasing abdominal distension. A third client has superficial facial lacerations. A fourth client reports mild neck pain, but is neurologically intact. Which client requires immediate attention? A. The client with a deformed wrist and intact pulses. B. The client with abdominal bruising and increasing abdominal distension. C. The client with superficial facial lacerations. D. The client with mild neck pain and no neurological deficits. Answer. B. The client with abdominal bruising and increasing abdominal distension. Rationale: increasing abdominal distension following trauma suggests internal hemorrhage and possible hemorrhagic shock, making this the highest priority. Question 8. A nurse on a pediatric unit is assigned 4 clients. One child with asthma is using accessory muscles and has audible wheezing despite treatment. Another child has a temperature of 102 degrees Fahrenheit, 38.9 degrees Celsius. A third child is awaiting discharge teaching. A fourth child requests a snack. Which child should the nurse assess first? A. The child with asthma using accessory muscles and audible wheezing. B. The child with a temperature of 102 degrees Fahrenheit, 38.9 degrees Celsius. C. The child awaiting discharge teaching. D. The child requesting a snack. Answer. A. The child with asthma using accessory muscles and audible wheezing. Rationale: increased work of breathing and persistent wheezing indicate respiratory distress and possible impending respiratory failure. Question 9. A nurse receives report on 4 clients in a cardiac step-down unit. One client develops sudden hypotension and jugular venous distension after pacemaker insertion. Another client reports mild incisional discomfort following coronary artery bypass surgery. A third client has stable atrial flutter. A fourth client requests assistance with hygiene. Which client should the nurse assess first? A. The client with sudden hypotension and jugular venous distension after pacemaker insertion. B. The client with mild incisional discomfort after CABG. C. The client with stable atrial flutter. D. The client requesting assistance with hygiene. Answer: A. The client with sudden hypotension and jugular venous distension after pacemaker insertion. Rationale: these findings suggest cardiac tamponade, a life-threatening condition that can rapidly impair cardiac output and lead to cardiovascular collapse. Question 10. A nurse is caring for 4 clients in a medical unit. One client receiving a blood transfusion develops chills, flank pain, and shortness of breath. Another client with pneumonia has a productive cough. A third client requests assistance with meal setup. A fourth client is awaiting discharge paperwork. Which client should the nurse assess immediately? A. The client receiving a blood transfusion who develops chills, flank pain, and shortness of breath. B. The client with pneumonia and a productive cough. C. The client requesting assistance with meal setup. D. The client awaiting discharge paperwork. Answer: A. The client receiving a blood transfusion who develops chills, flank pain, and shortness of breath. Rationale: these findings are characteristic of an acute hemolytic transfusion reaction. This complication can rapidly progress to shock, disseminated intravascular coagulation, acute kidney injury, and death if not treated immediately. Question 11. A nurse on a medical intensive care unit is caring for 4 clients. The first client has acute pancreatitis and reports abdominal pain rated 8 out of 10 despite opioid administration 1 hour ago. The second client has septic shock and a urine output of 15 milliliters during the previous hour despite receiving aggressive fluid resuscitation and vasopressor support. The third client has a stage 3 pressure injury requiring a dressing change. The fourth client requests assistance with oral hygiene. Which client should the nurse assess first? A. The client with acute pancreatitis and persistent abdominal pain. B. The client with septic shock and urine output of 15 milliliters per hour. C. The client with a stage 3 pressure injury requiring dressing changes. D. The client requesting oral hygiene assistance. Answer: B. The client with septic shock and urine output of 15 milliliters per hour. Rationale: oliguria is a sign of worsening organ hypoperfusion and possible progression to multiple organ dysfunction syndrome. Immediate assessment is required to evaluate the effectiveness of treatment and prevent further deterioration. Question 12. A nurse receives report on 4 postoperative clients. One client is 24 hours post-thyroidectomy and reports tingling around the mouth and fingertips. Another client is 2 days post-appendectomy and reports incisional pain rated 5 out of 10. A third client is 1 day post-total knee replacement and requests assistance with ambulation. A fourth client is awaiting discharge teaching. Which client should the nurse assess first? A. The client reporting tingling around the mouth and fingertips after thyroidectomy. B. The client reporting incisional pain after appendectomy. C. The client requesting assistance with ambulation after knee replacement. D. The client awaiting discharge teaching. Answer: A. The client reporting tingling around the mouth and fingertips after thyroidectomy. Rationale: perioral numbness and tingling suggest hypocalcemia caused by parathyroid gland injury. Severe hypocalcemia can lead to laryngospasm, airway compromise, and cardiac complications. Question 13. A nurse on a telemetry floor is reviewing assessments of 4 clients. One client with heart failure gained 1 kilogram overnight and has mild pedal edema. Another client with stable angina requests pain medication for chronic back pain. A third client develops new-onset confusion and has an oxygen saturation of 88% on room air. A fourth client has a potassium level of 3.3 milliequivalent/L and is awaiting supplementation. Which client should the nurse assess first? A. The client with heart failure and overnight weight gain. B. The client with stable angina requesting pain medication. C. The client with new-onset confusion and oxygen saturation of 88%. D. The client with potassium level of 3.3 milliequivalent/L. Answer: C. the client with new onset confusion and oxygen saturation of 88%. Rationale: hypoxemia combined with altered mental status suggests inadequate oxygen delivery to the brain and possible respiratory failure. Airway and breathing take priority. Question 14. A nurse in the emergency department receives 4 clients simultaneously. One client reports sudden severe chest pain radiating to the back and describes the pain as tearing. Another client has a temperature of 103 degrees Fahrenheit, 39.4 degrees Celsius, with generalized body aches. A third client has a deep laceration requiring sutures. A fourth client reports ankle pain following a basketball injury. Which client should the nurse prioritize? A. The client reporting tearing chest pain radiating to the back. B. The client with a high fever and body aches. C. The client with a laceration requiring sutures. D. The client with ankle pain following a sports injury. Answer: A. The client reporting tearing chest pain radiating to the back. Rationale: sudden tearing chest pain is a hallmark sign of aortic dissection, a life-threatening emergency associated with rapid cardiovascular collapse. Question 15. A nurse is caring for 4 clients on a renal unit. One client receiving hemodialysis becomes restless and complains of chest pain and shortness of breath. Another client with chronic kidney disease reports fatigue. A third client requests assistance with breakfast. A fourth client has stable hypertension and is awaiting medications. Which client requires immediate assessment? A. The client receiving hemodialysis who develops chest pain and shortness of breath. B. The client with chronic kidney disease reporting fatigue. C. The client requesting assistance with breakfast. D. The client with stable hypertension awaiting medications. Answer: A. The client receiving hemodialysis who develops chest pain and shortness of breath. Rationale: these findings may indicate an air embolism or another serious dialysis complication. Immediate intervention is required to prevent cardiovascular collapse. Question 16. A nurse on a pediatric oncology unit is caring for 4 children. One child with leukemia has a platelet count of 18,000/mm superscript 3 and develops a severe headache. Another child reports mild nausea following chemotherapy. A third child requests assistance with a video game. A fourth child asks for a snack. Which child should the nurse assess first? A. The child with leukemia, platelet count of 18,000/mm superscript 3, and severe headache. B. The child experiencing mild nausea after chemotherapy. C. The child requesting assistance with a video game. D. The child requesting a snack. Answer: A. The child with leukemia, platelet count of 18,000/mm superscript 3, and severe headache. Rationale: severe thrombocytopenia combined with a sudden headache raises concern for intracranial hemorrhage, which is a medical emergency. Question 17. A nurse receives report on 4 clients in a cardiac step-down unit. One client develops sudden shortness of breath, tachycardia, and pleuritic chest pain 2 days after hip replacement surgery. Another client reports mild nausea after breakfast. A third client requests assistance with bathing. A fourth client is awaiting discharge instructions. Which client should the nurse assess first? A. The client with sudden shortness of breath, tachycardia, and pleuritic chest pain. B. The client reporting mild nausea after breakfast. C. The client requesting assistance with bathing. D. The client awaiting discharge instructions. Answer: A. The client with sudden shortness of breath, tachycardia, and pleuritic chest pain. Rationale: these findings strongly suggest a pulmonary embolism. Immediate assessment is necessary because the condition can rapidly become fatal. Question 18. A nurse caring for clients in a neurological intensive care unit notes the following findings. One client with a traumatic brain injury develops a widening pulse pressure and bradycardia. Another client requests repositioning. A third client reports a headache rated 3 out of 10. A fourth client asks for assistance making a phone call. Which client should the nurse assess first? A. The client with traumatic brain injury who develops widening pulse pressure and bradycardia. B. The client requesting repositioning. C. The client reporting a headache rated 3 out of 10. D. The client requesting assistance with a phone call. Answer: A. The client with traumatic brain injury who develops widening pulse pressure and bradycardia. Rationale: widening pulse pressure and bradycardia are components of Cushing's response, indicating increased intracranial pressure and impending brain herniation. Question 19. A nurse is caring for 4 laboring clients. One client experiences a prolonged fetal heart rate deceleration to 70 beats/min lasting 4 minutes. Another client reports back labor discomfort. A third client requests ice chips. A fourth client is in early labor with reassuring fetal monitoring. Which client requires immediate assessment? A. The client with a prolonged fetal heart rate deceleration to 70 beats/min. B. The client reporting back labor discomfort. C. The client requesting ice chips. D. The client in early labor with reassuring fetal monitoring. Answer: A. The client with a prolonged fetal heart rate deceleration to 70 beats/min. Rationale: prolonged fetal bradycardia indicates fetal hypoxia and requires immediate intervention to prevent fetal injury or death. Question 20. A nurse on a medical surgical floor is caring for 4 clients. One client with cirrhosis suddenly becomes confused and difficult to arouse. Another client reports abdominal discomfort after lunch. A third client requests assistance to the bathroom. A fourth client is waiting for discharge prescriptions. Which client should the nurse assess first? A. The client with cirrhosis who suddenly becomes confused and difficult to arouse. B. The client reporting abdominal discomfort after lunch. C. The client requesting assistance to the bathroom. D. The client waiting for discharge prescriptions. Answer: A. The client with cirrhosis who suddenly becomes confused and difficult to arouse. Rationale: acute changes in mental status may indicate hepatic encephalopathy, severe metabolic disturbances, or worsening liver failure. Immediate assessment is required to prevent further neurological deterioration. Question 21. A nurse on a progressive care unit is assigned 4 clients at the start of the shift. The first client was admitted with community-acquired pneumonia and now has an oxygen saturation of 89% while receiving oxygen at 2 liters per minute via nasal cannula. The second client is 12 hours postoperative following a bowel resection and has absent bowel sounds in all 4 quadrants. The third client has chronic heart failure and reports mild ankle swelling at the end of the day. The fourth client with type 2 diabetes mellitus is awaiting breakfast before receiving scheduled insulin. Which client should the nurse assess first? A. The client with pneumonia whose oxygen saturation is 89% on supplemental oxygen. B. The client 12 hours postoperative with absent bowel sounds. C. The client with chronic heart failure and mild ankle swelling. D. The client with type 2 diabetes awaiting breakfast before insulin administration. Answer: A. The client with pneumonia whose oxygen saturation is 89% on supplemental oxygen. Rationale: oxygen saturation below normal despite oxygen therapy indicates worsening respiratory compromise and potential progression to respiratory failure. Airway and breathing concerns take priority over expected postoperative findings and stable chronic conditions. Question 22. A nurse receives report on 4 clients in the emergency department. The first client has crushing substernal chest pain accompanied by diaphoresis, and a 12-lead ECG shows ST segment elevation in multiple leads. The second client has a fractured humerus and rates pain as 9 out of 10. The third client is experiencing nausea and vomiting related to gastroenteritis. The fourth client has a migraine headache and requests a quiet, dark room. Which client should the nurse assess first? A. The client with ST segment elevation and crushing chest pain. B. The client with a fractured humerus and severe pain. C. The client with nausea and vomiting. D. The client with a migraine headache. Answer: A. The client with ST segment elevation and crushing chest pain. Rationale: ST segment elevation myocardial infarction, STEMI, is a time-sensitive emergency. Rapid assessment and intervention are required to restore coronary perfusion and reduce myocardial damage. Question 23. A nurse is caring for 4 clients in a trauma-intensive care unit. The first client sustained multiple rib fractures and suddenly develops severe dyspnea, absent breath sounds on the left side, hypotension, and tracheal deviation. The second client reports postoperative abdominal pain, rated 7 out of 10. The third client requests assistance with repositioning. The fourth client has stable vital signs and is awaiting family visitation. Which client should the nurse assess first? A. The client with multiple rib fractures and severe dyspnea. B. The client reporting postoperative abdominal pain. C. The client requesting repositioning. D. The client awaiting family visitation. Answer: A. The client with multiple rib fractures and severe dyspnea. Rationale: absent breath sounds, tracheal deviation, and hypotension indicate a tension pneumothorax, a life-threatening emergency that can rapidly result in cardiovascular collapse. Question 24. A nurse is reviewing laboratory results and assessments for 4 clients. The first client receiving warfarin has an INR of 6.2 and reports black, tarry stools. The second client receiving antibiotics reports mild nausea. The third client recovering from pneumonia reports fatigue. The fourth client requests assistance with discharge paperwork. Which client should the nurse assess first? A. The client with an INR of 6.2 and black, tarry stools. B. The client receiving antibiotics who reports nausea. C. The client recovering from pneumonia who reports fatigue. D. The client requesting discharge paperwork. Answer: A. The client with an INR of 6.2 and black, tarry stools. Rationale: the elevated INR and evidence of gastrointestinal bleeding indicate a potentially life-threatening hemorrhage requiring immediate intervention. Question 25. A nurse in the emergency department receives 4 clients from Triage. The first client has a history of asthma and is speaking only one-word sentences while using accessory muscles to breathe. The second client has a sprained ankle. The third client has an infected finger with localized swelling. The fourth client requests evaluation for seasonal allergies. Which client should the nurse assess first? A. The client with asthma speaking one-word sentences and using accessory muscles. B. The client with a sprained ankle. C. The client with an infected finger. D. The client requesting evaluation for seasonal allergies. Answer: A. The client with asthma speaking one-word sentences and using accessory muscles. Rationale: inability to speak in full sentences is a sign of severe respiratory distress and possible impending respiratory failure. Question 26. A nurse is caring for 4 clients following cardiac procedures. The first client underwent cardiac catheterization 1 hour ago and develops sudden bleeding at the femoral insertion site accompanied by hypotension and tachycardia. The second client reports mild nausea after breakfast. The third client requests assistance with personal hygiene. The fourth client asks questions regarding discharge medications. Which client requires immediate assessment? A. The client with bleeding at the femoral insertion site and hypotension. B. The client reporting mild nausea. C. The client requesting assistance with hygiene. D. The client asking questions about medications. Answer: A. The client with bleeding at the femoral insertion site and hypotension. Rationale: active hemorrhage after cardiac catheterization can rapidly lead to shock and requires immediate intervention. Question 27. A nurse is assigned 4 clients on a neurological unit. The first client experienced an ischemic stroke 24 hours ago and suddenly develops difficulty swallowing, drooling, and a wet, gurgling voice. The second client reports chronic back pain, rated 4 out of 10. The third client requests assistance with lunch. The fourth client is awaiting transportation home. Which client should the nurse assess first? A. The client with stroke who develops difficulty swallowing and a wet, gurgling voice. B. The client reporting chronic back pain. C. The client requesting assistance with lunch. D. The client awaiting transportation home. Answer: A. The client with stroke who develops difficulty swallowing and a wet, gurgling voice. Rationale: these findings suggest impaired airway protection and aspiration risk. Airway management takes priority over all other needs. Question 28. A nurse caring for clients on a hematology-oncology unit receives the following information. 1 client receiving chemotherapy has an absolute neutrophil count of 400/mm superscript 3 and a temperature of 101.5 degrees Fahrenheit 38.6 degrees Celsius. Another client with iron deficiency anemia reports fatigue. A third client requests assistance with bathing. A fourth client is awaiting discharge education. Which client should the nurse assess first? A. The client receiving chemotherapy with an ANC of 400/mm superscript 3 and fever. B. The client with iron deficiency anemia reporting fatigue. C. The client requesting assistance with bathing. D. The client awaiting discharge education. Answer. A. The client receiving chemotherapy with an ANC of 400/mm superscript 3 and fever. Rationale: febrile neutropenia is an oncologic emergency because even a minor infection can rapidly progress to septic shock. Question 29. A nurse is caring for 4 clients in a burn unit. The first client sustained burns covering 45% of total body surface area and develops decreased urine output, tachycardia, and hypotension. The second client reports pain during a dressing change. The third client requests assistance with meals. The fourth client asks for an additional blanket. Which client requires priority assessment? A. The client with extensive burns who develops decreased urine output, tachycardia, and hypotension. B. The client reporting pain during a dressing change. C. The client requesting assistance with meals. D. The client requesting an additional blanket. Answer. A. The client with extensive burns who develops decreased urine output, tachycardia, and hypotension. Rationale: these findings suggest burn shock and inadequate tissue perfusion, placing the client at risk for organ failure. Question 30. A nurse is caring for 4 clients during a night shift. The first client admitted with gastrointestinal bleeding suddenly becomes pale, diaphoretic, confused, and hypotensive with a blood pressure of 82/48 mm of mercury. The second client requests medication for insomnia. The third client asks for assistance to the restroom. The fourth client is sleeping comfortably. Which client should the nurse assess first? A. The client with gastrointestinal bleeding who becomes pale, diaphoretic, confused, and hypotensive. B. The client requesting medication for insomnia. C. The client requesting assistance to the restroom. D. The client who is sleeping comfortably. Answer. A. The client with gastrointestinal bleeding who becomes pale, diaphoretic, confused, and hypotensive. Rationale: these findings indicate hemorrhagic shock. Immediate assessment and intervention are required to prevent cardiovascular collapse and death. Question 31. A charge nurse on a busy medical surgical unit is notified of 4 changing client conditions simultaneously. The first client is 24 hours postoperative following a total hip arthroplasty and suddenly becomes restless, tachypneic, and reports sharp pleuritic chest pain. The second client with chronic kidney disease has a serum potassium level of 6.4 milliequivalent/L, and telemetry monitoring reveals peak T waves. The third client recovering from pneumonia requests assistance to the bathroom. The fourth client is awaiting discharge instructions. Which client should the nurse assess first? A. The postoperative hip arthroplasty client with sudden chest pain and tachypnea. B. The client with chronic kidney disease, potassium 6.4 milliequivalent/L, and peak T waves. C. The client recovering from pneumonia who needs assistance to the bathroom. D. The client awaiting discharge instructions. Answer. A. The postoperative hip arthroplasty client with sudden chest pain and tachypnea. Rationale: sudden chest pain, tachypnea, and restlessness after hip surgery suggest a pulmonary embolism, a life-threatening respiratory emergency requiring immediate assessment. Question 32. A nurse caring for clients in a step-down unit receives the following reports. One client admitted with sepsis has a blood pressure of 78/40 mm Hg despite receiving aggressive fluid resuscitation. Another client reports incisional pain rated 8 out of 10 following abdominal surgery. A third client requests antiemetic medication for nausea. A fourth client asks for assistance selecting meals. Which client should the nurse assess first? A. The client with sepsis and persistent hypotension despite fluids. B. The client with postoperative pain rated 8 out of 10. C. The client requesting antiemetic medication. D. The client requesting meal selection assistance. Answer. A. The client with sepsis and persistent hypotension despite fluids. Rationale: persistent hypotension despite treatment indicates worsening septic shock and inadequate tissue perfusion, requiring immediate intervention. Question 33. A nurse is caring for 4 clients on a telemetry floor. The monitor technician reports several rhythm changes. One client is experiencing sustained ventricular tachycardia and reports dizziness. Another client has atrial fibrillation with a ventricular rate of 104 per minute. A third client has occasional premature ventricular contractions. A fourth client has sinus bradycardia at 58 per minute while sleeping. Which client should the nurse assess first? A. The client with sustained ventricular tachycardia and dizziness. B. The client with atrial fibrillation and ventricular rate of 104 per minute. C. The client with occasional premature ventricular contractions. D. The client with sinus bradycardia while sleeping. Answer: A. The client with sustained ventricular tachycardia and dizziness. Rationale: sustained ventricular tachycardia can rapidly deteriorate into ventricular fibrillation and cardiac arrest. Dizziness indicates decreased cardiac output. Question 34. A nurse in the emergency department receives 4 clients following an industrial explosion. One client has partial thickness burns to both arms. Another client has an open femur fracture with controlled bleeding. A third client has facial burns, singed nasal hairs, hoarseness, and increasing inspiratory stridor. A fourth client has superficial abrasions and stable vital signs. Which client should the nurse assess first? A. The client with partial thickness burns to both arms. B. The client with an open femur fracture and controlled bleeding. C. The client with facial burns, hoarseness, and inspiratory stridor. D. The client with superficial abrasions. Answer: C. The client with facial burns, hoarseness, and inspiratory stridor. Rationale: these findings indicate inhalation injury and impending airway obstruction. Airway emergencies always take priority. Question 35. A nurse is participating in disaster triage after a mass casualty incident. Which client should receive immediate treatment according to disaster triage principles? A. A client with an open tibial fracture who is alert and has stable vital signs. B. A client with chest trauma who has a respiratory rate of 8 per minute but begins breathing adequately after airway repositioning. C. A client with minor lacerations who is ambulatory. D. A client who is pulseless and apneic despite airway repositioning. Answer: B. A client with chest trauma who has a respiratory rate of 8 per minute but begins breathing adequately after airway repositioning. Rationale: disaster triage prioritizes clients with life-threatening but survivable conditions. This client can benefit from immediate intervention and has a good chance of survival. Question 36. A nurse is caring for 4 postoperative clients. One client underwent carotid endarterectomy several hours ago and suddenly develops neck swelling, difficulty swallowing, and inspiratory stridor. Another client requests pain medication following knee surgery. A third client requests assistance with ambulation. A fourth client asks questions about discharge instructions. Which client should the nurse assess first? A. The client who develops neck swelling, dysphagia, and stridor. B. The client requesting pain medication. C. The client requesting ambulation assistance. D. The client requesting discharge instructions. Answer: A. The client who develops neck swelling, dysphagia, and stridor. Rationale: a postoperative neck hematoma can rapidly compress the airway and cause complete airway obstruction if not treated immediately. Question 37. A nurse is caring for 4 clients in a critical care unit. One client being treated for diabetic ketoacidosis has a blood glucose level of 250 milligrams per deciliter and a potassium level of 2.9 milliequivalent/L during insulin therapy. Another client with pancreatitis reports abdominal pain. A third client requests repositioning. A fourth client is resting quietly. Which client should the nurse assess first? A. The client with diabetic ketoacidosis and potassium level of 2.9 milliequivalent/L. B. The client with pancreatitis reporting abdominal pain. C. The client requesting repositioning. D. The client resting quietly. Answer: A. The client with diabetic ketoacidosis and potassium level of 2.9 milliequivalent/L. Rationale: severe hypokalemia during insulin therapy places the client at risk for life-threatening cardiac dysrhythmias and cardiac arrest. Question 38. A nurse receives report on 4 postpartum clients. One client who delivered 12 hours ago suddenly develops shortness of breath, pleuritic chest pain, tachycardia, and anxiety. Another client reports moderate uterine cramping. A third client requests breastfeeding assistance. A fourth client asks questions regarding newborn bathing techniques. Which client should the nurse assess first? A. The postpartum client with sudden shortness of breath and chest pain. B. The client reporting moderate uterine cramping. C. The client requesting breastfeeding assistance. D. The client asking about newborn bathing. Answer: A. The postpartum client with sudden shortness of breath and chest pain. Rationale: these findings suggest pulmonary embolism, a potentially fatal postpartum complication requiring immediate intervention. Question 39. A nurse is caring for 4 clients on a surgical unit. One client who underwent bowel surgery develops abdominal rigidity, rebound tenderness, fever, and tachycardia. Another client reports nausea after lunch. A third client requests assistance with hygiene. A fourth client is awaiting discharge transportation. Which client requires immediate assessment? A. The client with abdominal rigidity, rebound tenderness, fever, and tachycardia. B. The client reporting nausea after lunch. C. The client requesting hygiene assistance. D. The client awaiting transportation. Answer: A. The client with abdominal rigidity, rebound tenderness, fever, and tachycardia. Rationale: these findings suggest peritonitis or an anastomotic leak, both of which can rapidly progress to sepsis and shock. Question 40. A nurse is caring for 4 clients in a coronary care unit. One client with an acute myocardial infarction suddenly develops crushing chest pain unrelieved by nitroglycerin, diaphoresis, hypotension, and increasing shortness of breath. Another client has stable angina relieved by rest. A third client requests assistance with a meal tray. A fourth client asks for a blanket. Which client should the nurse assess first? A. The client with acute myocardial infarction and worsening symptoms. B. The client with stable angina relieved by rest. C. The client requesting assistance with a meal tray. D. The client requesting a blanket. Answer: A. The client with acute myocardial infarction and worsening symptoms. Rationale: these findings indicate worsening myocardial ischemia and possible cardiogenic shock. Immediate intervention is required to preserve cardiac function and prevent death. Question 41. A nurse is assigned 4 clients in a high-acuity progressive care unit. The first client is admitted with acute respiratory distress syndrome, ERDS, and suddenly becomes increasingly agitated. Over the last hour, the client's oxygen saturation has declined from 94% to 84% despite receiving high-flow oxygen therapy. The second client has chronic heart failure and reports mild fatigue after ambulating. The third client requests assistance with breakfast setup. The fourth client is awaiting discharge instructions from the healthcare provider. Which client should the nurse assess first? A. The client with ARDS whose oxygen saturation dropped from 94% to 84%. B. The client with chronic heart failure reporting mild fatigue. C. The client requesting breakfast assistance. D. The client awaiting discharge instructions. Answer: A. The client with ARDS whose oxygen saturation dropped from 94% to 84%. Rationale: agitation is often an early sign of worsening hypoxia. A significant decline in oxygen saturation despite oxygen therapy indicates impending respiratory failure and requires immediate intervention. Question 42. A nurse receives report on 4 clients. The first client with end-stage liver disease develops increasing confusion, hysterexis, and difficulty following commands. The second client with chronic obstructive pulmonary disease reports mild dyspnea after walking to the bathroom. The third client requests assistance with bathing. The fourth client is awaiting a dietary consultation. Which client should the nurse assess first? A. The client with liver disease who develops confusion and hysterexis. B. The client with COPD reporting mild dyspnea. C. The client requesting assistance with bathing. D. The client awaiting dietary consultation. Answer: A. The client with liver disease who develops confusion and hysterexis. Rationale: these findings indicate worsening hepatic encephalopathy, which may progress to coma and compromise airway protection. Question 43. A nurse is caring for 4 clients in the emergency department. The first client sustained severe facial trauma and is gurgling blood while attempting to breathe. The second client has a displaced wrist fracture and severe pain. The third client reports severe dental pain and facial swelling. The fourth client has a superficial laceration requiring sutures. Which client should the nurse assess first? A. The client with severe facial trauma, who is gurgling blood. B. The client with a displaced wrist fracture. C. The client with severe dental pain. D. The client with a superficial laceration. Answer. A. The client with severe facial trauma, who is gurgling blood. Rationale. The client's airway is immediately threatened. Airway obstruction always takes priority over circulation, pain, and comfort concerns. Question 44. A nurse reviews the following changes in client status. One client with acute pancreatitis suddenly develops a respiratory rate of 34 per minute, oxygen saturation of 86%, and bilateral crackles throughout the lung fields. Another client reports nausea after lunch. A third client requests assistance ambulating in the hallway. A fourth client requests fresh water. Which client requires immediate assessment? A. The client with pancreatitis who develops tachypnea, crackles, and hypoxemia. B. The client reporting nausea after lunch. C. The client requesting ambulation assistance. D. The client requesting fresh water. Answer. A. The client with pancreatitis who develops tachypnea, crackles, and hypoxemia. Rationale. Acute pancreatitis can trigger ERDS. Respiratory deterioration is life-threatening and requires immediate intervention. Question 45. A nurse is caring for 4 clients on a cardiac unit. Which client should prompt activation of the rapid response team? A. Blood pressure 138/82 mmHg, heart rate 88 per minute, reports incisional pain. B. Blood pressure 90/58 mmHg, heart rate 118 per minute, oxygen saturation 88%, increasing confusion. C. Blood pressure 150/88 mmHg, heart rate 92 per minute, requesting a snack. D. Blood pressure 126/74 mmHg, heart rate 80 per minute, awaiting discharge. Answer. B. Blood pressure 90/58 mmHg, heart rate 118 per minute, oxygen saturation 88%, increasing confusion. Rationale. Hypotension, tachycardia, hypoxemia, and altered mental status indicate significant clinical deterioration and warrant immediate rapid response team activation. Question 46. A charge nurse on a telemetry unit receives reports from staff nurses. Which client should the charge nurse instruct the staff nurse to assess first? A. A client with potassium level of 6.4 milliequivalent/L, muscle weakness, and peak T waves. B. A client with potassium level of 3.4 milliequivalent/L awaiting supplementation. C. A client with stable atrial fibrillation and heart rate of 82 per minute. D. A client with chronic heart failure and trace pedal edema. Answer. A. A client with potassium level of 6.4 milliequivalent/L, muscle weakness, and peak T waves. Rationale. Severe hyperkalemia with ECG changes can rapidly result in ventricular fibrillation or asystole and requires immediate treatment. Question 47. A nurse is caring for 4 postoperative clients. The first client underwent abdominal surgery and over a 2-hour period has developed increasing tachycardia, falling blood pressure, cool clammy skin, and delayed capillary refill. The second client reports incisional pain rated 6 out of 10. The third client requests assistance turning in bed. The fourth client asks questions regarding discharge medications. Which client should the nurse assess first? A. The postoperative client with tachycardia, hypotension, and cool clammy skin. B. The client reporting incisional pain. C. The client requesting assistance turning in bed. D. The client asking about discharge medications. Answer. A. The postoperative client with tachycardia, hypotension, and cool clammy skin. Rationale. These findings indicate possible postoperative hemorrhage and shock. Immediate intervention is necessary to prevent cardiovascular collapse. Question 48. A nurse reviews morning laboratory values and assessments. Which client should the nurse assess first? A. Hemoglobin 6.4 g/dl, heart rate 132 per minute, dizziness, and shortness of breath. B. Hemoglobin 10.8 g/dl with mild fatigue. C. White blood cell count 11,200/mm superscript 3 without symptoms. D. Sodium level 134 milliequivalent/L without symptoms. Answer. A. Hemoglobin 6.4 g/dl, heart rate 132 per minute, dizziness, and shortness of breath. Rationale. Severe symptomatic anemia compromises oxygen delivery to tissues and can result in cardiovascular instability and organ dysfunction. Question 49. A nurse in the intensive care unit is caring for 4 clients. The first client with septic shock develops worsening hypotension, mottled skin, elevated lactate levels, and decreased responsiveness. The second client reports generalized weakness. The third client requests assistance with oral care. The fourth client asks about visiting hours. Which client should the nurse assess first? A. The client with septic shock and worsening hypotension. B. The client reporting generalized weakness. C. The client requesting oral care. D. The client asking about visiting hours. Answer. A. The client with septic shock and worsening hypotension. Rationale. These findings indicate progression toward multiple organ dysfunction syndrome and severe tissue hypoperfusion. Question 50. A nurse is working in a busy emergency department when 4 clients arrive simultaneously. The first client is a 72-year-old who developed sudden inability to speak, right-sided paralysis, and facial drooping 30 minutes ago. The second client is a 54-year-old with intermittent chest discomfort for the past 2 weeks that resolves with rest. The third client is a 30-year-old with a sore throat and temperature of 101 degrees Fahrenheit, 38.3 degrees Celsius. The fourth client is a 25-year-old with a simple forearm laceration sustained while cooking. Which client should the nurse assess first? A. The 72-year-old with sudden inability to speak and right-sided paralysis. B. The 54-year-old with intermittent chest discomfort relieved by rest. C. The 30-year-old with fever and sore throat. D. The 25-year-old with a simple forearm laceration. Answer. A. The 72-year-old with sudden inability to speak and right-sided paralysis. Rationale. This client is demonstrating signs of an acute ischemic stroke within the thrombolytic treatment window. Rapid assessment and intervention can significantly improve neurological outcomes and reduce disability. Excellent work completing all 50 high-stakes NCLEX triage case studies. Remember, success on prioritization questions is not about memorizing answers. It's about recognizing life-threatening conditions and applying sound clinical judgment under pressure. Always think airway, breathing, circulation, then evaluate who is unstable, who is deteriorating, and who requires immediate intervention. If you found this video helpful, don't forget to like, subscribe, and turn on notifications so you never miss future NCLEX mastery content. Share your score in the comments, and let us know which question challenged you the most. Thank you for watching MCQs Master 101. Keep practicing, keep learning, and keep moving one step closer to passing the NCLEX. See you in the next video.